grown children and boyfriend. My oldest child dropped out of high school, went back, got his GED, got his bachelor's from college, is working now in a nursing home. He cannot afford to have health care. My boyfriend was working at $11 an hour as a mail clerk, was laid off in January. He's now getting unemployment compensation. We applied for medical assistance, and they tell us that he's earning too much money to get medical assistance. So he does not have any access to health care. My daughter is the best well-to-do of the family. She and her husband are doing very well, thank you very much. But if they should lose their jobs, and in this economy that's not totally unexpected concern, then what happens with that family? My youngest son is the luckiest of all of them. He has a major mental disease, and he's covered by SSI and Social Security. Thank God for some of these government programs. I am retired. I get a pension from having worked for the government. I get Social Security, and I'm covered by Medicare, but not completely. I need to buy supplementary insurance, and I do that from a private company. My concern is, I'm grateful that I've been healthy all my life. I've hardly ever been in the hospital except once to give birth. But the other times I gave birth at home. If I get a major illness, I really don't trust this health company, that they will not try to wiggle out of it, that they will not try and find some reason why they don't have to cover me. So that's my family, and there are a number of implicit questions.
Yes, in the first portion is, we cover in this bill up to 400% on a sliding scale of poverty level. For a family of 4, for example, that's $82,000. If your income is $82,000 on a sliding scale up to that amount, we will cover you so you can afford it. And it's mandated no more than 12% of your income can go towards that. And that's where the sliding scale is affected to make sure we cover the rest. Second is, no insurance company is permitted to refuse you coverage. And if you now have a problem, instead of coming to Bill Walsh in the congressional office and we have scores and scores of them, there is an ombudsman that has been set up that you actually report to, where it's mandated that they are, and this was my amendment, it's mandated that they have to discuss the issues with the patient advocates that are on the board that oversee and set the minimum benefits that are required to be in healthcare plans. So you now have a conduit to raise problems when it happens. The issue will be how well is it executed. But so your son and boyfriend are covered up to that amount, and so that they will be afforded to get a next job, because it's mandated they have to have health insurance. So that's how